Throughout human history, disease has shaped civilizations, toppled empires, and transformed societies. From the Black Death to COVID-19, epidemics have left indelible marks on our world, claiming millions of lives and altering the course of history. This visualization shows the scale and impact of major epidemics throughout history, with the size of each circle representing the number of deaths. Behind the scenes of these devastating outbreaks, a scientific discipline emerged to understand and control the spread of disease. Meet the unseen heroes who developed the tools and methods to combat these invisible enemies, the epidemiologists. From early pioneers who tracked disease patterns by hand to modern scientists using advanced laboratory techniques and data analysis, these individuals revolutionized public health. Join us as we count down the 10 most influential epidemiologists in history, brilliant minds whose work has saved countless lives and continues to shape our response to disease outbreaks today. Alexander Langmuir stands as a pivotal figure in the history of epidemiology, revolutionizing how public health threats are identified and contained. In 1951, Langmuir founded the Epidemic Intelligence Service at the CDC during the height of the Cold War. This program was initially created as a response to biological warfare concerns, but quickly evolved into a cornerstone of public health response to natural outbreaks. Langmuir's vision was to create a program that would train highly skilled field epidemiologists, what he called disease detectives, who could rapidly investigate outbreaks, build surveillance systems, and respond to public health emergencies anywhere in the world. The EIS program revolutionized epidemiological training with its hands-on approach. Officers complete a rigorous 2-year fellowship where they learn through direct field experience, what Langmuir called shoe leather epidemiology. This practical training encompasses outbreak investigation, surveillance system design, and scientific communication. EIS officers have been at the forefront of some of history's most significant public health crises. In 1955, they investigated complications with the polio vaccine. They identified Legionnaire's disease in 1976, documented the first AIDS cases in 1981, responded to anthrax bioterrorism in 2001, and helped contain Ebola in West Africa in 2014. Langmuir's vision fundamentally changed epidemiology by emphasizing rapid response and field investigation. He insisted that epidemiologists needed to be on the ground, collecting data firsthand. His methodical approach combined rigorous science with practical public health action, establishing a model that continues to influence global disease response today. Today, the EIS has trained over 3,000 epidemiologists who serve in health departments, universities, and international organizations worldwide. The program responds to hundreds of outbreak requests annually and has helped identify dozens of previously unknown disease agents. Langmuir's legacy continues through this network of disease detectives who protect public health across the globe. Louis Pasteur, a French scientist born in 1822, revolutionized our understanding of disease with his groundbreaking work on germ theory. Pasteur challenged the prevailing belief in spontaneous generation. Through his famous swan neck flask experiments, he demonstrated that microorganisms don't spontaneously appear, but rather come from pre-existing microbes in the air. Pasteur went on to identify specific microorganisms responsible for diseases, establishing the connection between germs and illness. This revolutionary discovery fundamentally transformed our understanding of disease transmission and prevention. Building on his germ theory, Pasteur developed vaccines for deadly diseases like anthrax and rabies. In 1885, he successfully treated Joseph Meister, a 9-year-old boy who had been bitten by a rabid dog, establishing the principle of vaccination that has since saved countless lives. Pasteur established systematic laboratory research methods that became the foundation of modern experimental medicine. His meticulous approach to growing cultures, sterilizing equipment, and controlling experimental conditions established the field of microbiology. Pasteur's germ theory revolutionized public health practices. It led to improved sanitation, hand washing protocols, food safety innovations like pasteurization, reductions in maternal mortality, and safer surgical practices. His work saved millions of lives by preventing disease transmission. Pasteur's contributions established the foundation for modern microbiology and immunology. Pasteurization remains in use today. His vaccine development methods paved the way for modern vaccines, and the Pasteur Institute, founded in 1887, continues his work worldwide. His meticulous methods and insights into the microbial world fundamentally changed how we understand and combat disease. Robert Koch was a German physician and microbiologist who made groundbreaking contributions to the field of bacteriology. In his laboratory, Koch established innovative techniques for growing and studying bacteria, including the development of solid culture media to isolate pure bacterial colonies. Koch's most significant contribution was the development of 4 criteria, now known as Koch's postulates, to establish a causal relationship between a microorganism and a disease. These 4 postulates provided a methodical framework to determine if a specific microorganism causes a specific disease. First, the microorganism must be found in all diseased organisms. Second, the microorganism must be isolated and grown in a pure culture. Third, the cultured microorganism should cause the disease when introduced into a healthy organism. Finally, the microorganism must be re-isolated from the newly infected organism and match the original microorganism. In 1882, Koch made one of his most significant discoveries by identifying Mycobacterium tuberculosis as the causative agent of tuberculosis, a disease that was claiming millions of lives at the time. Koch's work fundamentally transformed our understanding of infectious diseases. His methodical approach established the foundation for modern microbiology and enabled the development of targeted treatments and prevention strategies. Beyond tuberculosis, Koch identified several other disease-causing agents, including anthrax in 1876 and cholera in 1883. His rigorous methodology continues to influence disease research to this day. John Snow, a British physician, became one of the most influential figures in the history of public health through his investigation of London's 1854 cholera epidemic. Snow challenged the prevailing miasma theory, which attributed disease to bad air. Instead, he suspected contaminated water as the source of cholera transmission. In August 1854, a severe cholera outbreak struck the Soho district of London. Snow began a meticulous investigation, going door to door to document cases. Snow employed what we now call field epidemiology. He meticulously mapped the location of cholera deaths, interviewed residents, and analyzed water sources in the area. By plotting the cases on a map, Snow discovered a striking pattern. Most cholera deaths were clustered around the Broad Street water pump. His analysis showed the probability of contracting cholera decreased as the distance from the Broad Street pump increased. Residents who got their water from other pumps largely avoided the disease. Based on his evidence, Snow convinced local authorities to remove the handle from the Broad Street pump, preventing further use. Shortly after, the cholera outbreak subsided. John Snow's groundbreaking work permanently changed how we understand disease transmission and investigation. His methods established the foundation of modern epidemiology. By demonstrating that cholera was waterborne rather than airborne, Snow revolutionized public health practice. His pioneering use of maps to track disease spread and identify environmental sources earned him the title Father of Field Epidemiology. Modern epidemiology has been revolutionized by data science and technology. Electronic health records have transformed how we collect and analyze patient data. These digital systems allow epidemiologists to process millions of health records efficiently. Wearable technology provides continuous streams of health data. Devices like fitness trackers and smartwatches monitor vital signs and physical activity, offering unprecedented insights into population health patterns. Interactive dashboards enable public health officials to visualize and monitor disease trends in real time. These tools support data-driven decision-making during outbreaks and ongoing surveillance. Advanced analytics and machine learning algorithms can identify subtle patterns in large datasets. These technologies help predict disease outbreaks and optimize resource allocation during epidemics. These technological advancements are transforming epidemiological practice in three key ways. First, they enable more precise analysis through larger and more diverse datasets. Second, they support better causal inferences using advanced statistical models and methodologies. And finally, they lead to more informed and timely public health decisions that can save lives during outbreaks. As computational power continues to increase, the integration of advanced technologies with epidemiological methods will further enhance our ability to protect public health. Health equity has become a core principle in modern epidemiology. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires addressing disparities in health outcomes across different populations. Social determinants of health are factors outside the medical system that significantly impact health outcomes. These include economic stability, education, social context, neighborhood environment, and access to health care. These determinants include specific factors like housing, incarceration rates, poverty, food access, education levels, environmental quality, health insurance coverage, and health literacy. Health disparities exist across racial, ethnic, socioeconomic, geographic, and other demographic factors. For example, Black Americans face systemic barriers to healthcare access and experience different health outcomes. Modern epidemiologists increasingly recognize structural racism as a fundamental cause of health inequities in the United States. This represents a shift from focusing solely on individual behaviors to examining systemic factors. Community-based participatory research is a key approach epidemiologists use to address health inequities. By partnering directly with affected communities, researchers gain better insights and develop more effective interventions. Modern epidemiologists employ several approaches to address health equity. These include data disaggregation by demographic factors, inclusion of social variables in study design, development of equity-focused metrics, ensuring diverse community representation in research, and focusing on structural interventions rather than just individual behaviors. Health equity principles are being applied to many real-world issues. These include studying COVID-19 outcome disparities, developing interventions to address maternal mortality gaps, conducting environmental justice studies, mapping healthcare access deserts, and assessing the equity impact of public health policies. Health equity has become a central focus in modern epidemiology, recognizing that achieving optimal public health requires addressing the underlying social and structural factors that create and perpetuate health disparities. Personalized prevention represents the future of epidemiology, moving beyond traditional approaches that treat populations uniformly. Unlike conventional one-size-fits-all prevention strategies, personalized approaches tailor interventions to individuals based on their unique risk profiles. This approach recognizes that patients with the same diagnosis may respond differently to treatments, allowing for more targeted and effective interventions. Big data is transforming epidemiology, providing unprecedented insights from diverse sources, including electronic health records, genomic information, wearable technology, and environmental monitors. Artificial intelligence and machine learning are critical tools that enable personalized prevention by identifying patterns in complex data. These technologies excel at predictive analytics, risk stratification, and developing early warning systems. In practice, personalized prevention manifests through clinical risk assessment dashboards that help healthcare providers monitor multiple factors simultaneously and intervene proactively. Personalized prevention offers numerous advantages, including enhanced effectiveness of interventions, resource optimization, and reduced side effects. It also increases patient engagement, improves health outcomes, and proves more cost-effective in the long term. Despite its promise, personalized prevention faces challenges, including data privacy concerns, algorithmic bias, health equity issues, and implementation barriers that must be addressed for successful deployment. Looking ahead, epidemiology continues to evolve toward increasingly precise and individualized preventive strategies, informed by sophisticated data analysis and emerging technologies. Epidemiologists today face unprecedented global health challenges that require coordinated international responses. Three major challenges stand out: climate change, emerging infectious diseases, and commercial determinants of health. Climate change profoundly impacts human health through multiple pathways. Rising temperatures expand disease vector ranges. Extreme weather events cause injuries and displacement. Food and water insecurity lead to widespread malnutrition. Emerging infectious diseases present ongoing threats to global health security. New pathogens continue to emerge and spread worldwide. Zoonotic spillovers increase with deforestation and ecosystem disruption. Global travel and trade facilitate rapid disease spread, as we witnessed with COVID-19. Commercial determinants of health refer to corporate activities that affect health outcomes. Industry lobbying shapes health policies, often prioritizing profits over public health. Marketing strategies promote products known to be harmful, such as ultra-processed foods, tobacco, and fossil fuels that contribute to climate change. Addressing these challenges requires a truly global perspective. Health challenges transcend national borders, making international cooperation essential. Local solutions must consider global contexts while respecting cultural differences. Community health workers serve as vital bridges between global health strategies and local implementation. Epidemiologists have developed frameworks for coordinated global action. These include multinational responses with equitable resource distribution, focusing on sustainable development goals, and fostering interdisciplinary collaboration between health professionals, climate scientists, policymakers, and community leaders. Epidemiologists must continue adapting to these interconnected global challenges. They must combine scientific rigor with advocacy for health equity and sustainable development to protect global public health in the decades ahead. The CDC's Epidemic Intelligence Service, known as EIS, trains the next generation of disease detectives. Founded in 1951, this elite program prepares epidemiologists and health professionals to serve on the front lines of public health emergencies. EIS offers a 2-year fellowship in applied epidemiology, combining rigorous hands-on field experience with classroom training. EIS officers spend about 80% of their time investigating outbreaks and receive comprehensive training in data analysis and scientific communication. EIS officers learn to work in multidisciplinary outbreak investigation teams, bringing together expertise in epidemiology, laboratory science, environmental health, and communications. This collaborative approach ensures comprehensive responses to public health emergencies, from identifying the source of an outbreak to implementing control measures. Throughout its history, EIS officers have been at the forefront of responding to major public health emergencies. From the investigation of Legionnaire's disease in 1976 to the global COVID-19 pandemic, EIS officers have played crucial roles in identifying, tracking, and controlling disease outbreaks. The impact of EIS extends far beyond individual investigations. EIS alumni have gone on to lead major public health institutions and initiatives worldwide. With over 3,800 disease detectives trained since 1951, EIS graduates now serve in leadership positions across the globe, shaping the future of public health. Today, EIS continues to evolve, preparing officers to face new and emerging public health challenges. These include emerging infectious diseases, health impacts of climate change, antibiotic resistance, global health security concerns, and the integration of advanced data analytics into epidemic response. By training the next generation of disease detectives, EIS ensures that skilled epidemiologists will continue to protect public health for generations to come. Modern epidemiology faces unprecedented challenges with vast amounts of data and increasingly complex analyses required to extract meaningful insights. These challenges include the exponential growth in data volume, greater complexity in data structure, the need for real time analysis, and the integration of diverse data sources. Epidemiologists now leverage diverse big data sources both within and outside the traditional scope of healthcare. Electronic health records, wearable sensors, social media, and environmental monitoring all provide valuable insights. The scale and complexity of modern epidemiological data have outpaced traditional statistical methods. Today's analyses require significant computational resources. High-performance computing systems like this Cray XK6 supercomputer enable epidemiologists to process enormous data sets and run complex models that would be impossible with conventional computing resources. Despite these advancements, significant challenges remain in healthcare big data analytics. These include collecting and standardizing data, processing information in real time, and ensuring patient privacy and data security. Machine learning and artificial intelligence are transforming epidemiological analysis. These advanced computational approaches can identify patterns in complex datasets that would be impossible to detect using traditional methods. Applications include predicting disease outbreaks, identifying novel risk factors, monitoring population health in real time, and evaluating the effectiveness of public health interventions.